So today we find out where some of your favorite Massachusetts representatives stand when it comes to the ballot question number 1 on nurse staffing ratios. We also find out how you, if you're a nurse and you like babies, how you can make $800 a day. And then the nurse of the week might be the reason you are now able to look at birthing videos on Instagram and Facebook. Stories for weeks. Let's go get it.
You'll be doing things you don't like doing in order to go on living, that is, to go on doing things you don't like doing, which is stupid. Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Hey! Welcome back, you guys. Thank you very much for joining me. My name is Swadika Mayanja, and yes, you can call me Q. I am indeed Q the nurse, and on this channel I bring you news, current events, and fun topics for nurses everywhere. And we got the stories for y'all today. We got the stories for you today. So we're going to just jump on in and we're going to start high. We're going to start real high. Mega Millions high. So the Mega Millions, someone in South Carolina finally won the $1.586 billion Mega Millions jackpot ticket, which is good for them. But that's not why I'm talking about it. I'm talking about this because a homie, a nurse here in Massachusetts, my home state of Massachusetts, had a winning ticket, not the winning ticket, but her winning ticket got 5 out of the 6. I don't know, I didn't buy a ticket, but she got some of the numbers correct and she won $1 million. $1 million. Which I think is an absolutely fabulous thing for a nurse to win. So her name is Jennifer Santos and she's from Dartmouth, Massachusetts. Wonderful. Good for you, Jennifer. Congratulations as a nurse. I just believe it's karma. You give good in the world and the world gives you some good things back. It's also probably just 1000% luck, but I'll take it. A nurse getting $1 million, I'll take it every single day. Congrats, Jennifer. Congratulations. So on to some serious news, ladies and gents. Serious news. The staffing ratio bill. So let's first, before we get into your favorite representatives, because we're going to go there next. We're going there next. Don't you worry. Before we get into that, I just want to talk about the ads, because everyone and their mother is seeing all of these vote no from the coalition against. Vote no. And it is easy when you see those ads and they give really compelling reasons. It's going to cost $3 billion. Your premiums are going to go up. Wow, wee woo. The world is going to end if we get more nurses. When you see all those ads out there, it's for one reason and one reason only. Because they have the money. They have the money to do so. They have all the money in the world to put up all those ads. The coalition for the Massachusetts Nurses Association, who wrote the bill, who are made up of nurses, 23 or 28,000 nurses from Massachusetts are part of that union, and they represent those nurses who actually wrote the bill, don't have the kind of money that the coalition against has. And let me tell you where this money is coming from. So the coalition to protect patient safety, that's the coalition against, has raised more than $13 million since January of 2018. You're saying, wowzers, that's a lot of money. That's a good amount of money to put in those ads, right? Yes, let me tell you where the vast, and when I say vast, I mean 95%. So 95% of those funds have come from the Massachusetts Health and Hospital Association. 95% of this money is coming from the Hospital Association. The same hospital association that was against the bill when it passed in California. The same hospital association that cares only and only for the profits it makes at the end of the fiscal year. The company, the money that is used to be putting out all of these vote no ads is not coming from nurses that are just super worried about what's going to happen. I said 95%, so 5% of that money. Of course, maybe I have no idea who's the rest of the 5%, but I do know the vast majority, the 95%, the reason you were seeing all those ads on TV is because the Hospital Association, which by far their number one goal and their number one priority is the amount of money that these hospitals will make at the end of the fiscal year. They do not care. The last thing on their mind is nurse satisfaction. Forget about patient satisfaction. They just care about their wallet's satisfaction, okay? So I think there's two major ads out there. So number one, there's nurses that are coming on, and you see these ads where nurses are saying, "This is taking my autonomy away. I'm not going to be able to. The government's going to be running my." No. I disagree with that entirely, but that is a subjective. You think that I disagree. If you actually read the bill, it's not taking your autonomy away. It's keeping your practice safe, is the way I see it. But that's another conversation for another day. The other ad that you'll see out there. The big one is the one that they say, this is going to cost $1 billion a year. It's going to blow up Massachusetts budget. There's no way we can afford it. It's in the craziness about how much it's going to cost, right? I do want to let y'all know that there have been various studies, there's been multiple studies done on how the cost of this bill is going to affect Massachusetts as a whole, the healthcare, as the specific hospitals, right? So a study conducted by Boston College nursing economist Judith Schindel Rothschild found that the total cost of implementing the proposed nurse to patient staffing limits in Massachusetts would be about $35 million to $47 million per year, necessitating a 2 to 7% increase in the number of nurses employed. So this is important, right? So this is a Boston College nursing economist. She's an economist that is a nurse. She does nursing economist. That is her job. That's what she does. That's all she does, right? She did the study. She said, went through it, 2 to 7% increase in how many nurses are going to be needed for this bill for the hospital. So obliged with the actual ratios stated in the bill. And she came up with the numbers $35 to $47 million a year. And you might say, Q, wait a hot second. Wait a hot second, because the numbers I hear in the voting no ads or in just out there in the world is the $900 to $1 billion a year moving forward, which is insane. And I've said it myself in previous videos, that number is insane. It's super, super high. But the actual study is going to be in the link below. You can look at it. It's thorough. Very thorough. And she even added the 2 to 7% increase for the nurses that are going to need to be hired. The other study, that $900 million per year number, came from the Health Policy Commission, a state agency charged with monitoring healthcare delivery in Massachusetts, put out estimates that question one would cost somewhere between $676 million and $949 million per year. Now, ladies and gentlemen, that the disparity between those two numbers are mind-boggling. I mean, it's not $100 million. It's literally $800+ million difference between the two suggestions, between the two studies. They both either super, super off, or one study is just plain wrong. Those are the two options here, because those numbers are very, very, very different. So let me tell you, when they asked the Boston College professor, the economist, the nursing economist professor, why are the numbers such a difference? She says the biggest difference between her figures and those calculated by Health Policy Commission is that the commission's model assumes that nurse staffing limit will produce far greater levels of wage inflation, upward of 6%. So that is why there's such a disparity between the two studies, between those two calculated numbers of how much it would cost. The Health Policy Commission, when they did the study, they assumed that the nurse, not just adding the amount of nurses that are going to need, the 2 to 7% of nurses that are going to need to be added to the workforce to meet those ratios, not that, also adding a 6% increase in the wages of all nurses. And when I say all nurses, I don't mean the nurses that are hired or the nurses that are already working in hospitals. I mean literally every single nurse. And the professor said it herself. She continues by saying, not only did they assume a 6% wage inflation, but they assumed it for every nurse working in Massachusetts, regardless of if they work in hospitals or not. She continues on. They said if wages go up in hospitals, they'll go up across the board for every nurse, no matter where they work. I'm a nurse on a faculty of at Boston College, and there is no way they're increasing my salary by 6%, which I think is just of course not, right? Like, let's just think about this logically, right? Nurses that work in hospitals right now get paid more than than nurses that don't work in hospitals. So to make the argument that all nursing salaries are going to increase by 6%, whether they're not in hospitals or not, is berserk, is insane. Yes, I do have to agree, right? That they might increase the wages for nurses that work in hospitals might increase a bit in the beginning because they're going to need an incentive to get these nurses to come into the hospital. But a 6% increase? Let's be real. In the study from the Health Policy Commission, they assumed a 6% increase in wages for all nurses in Massachusetts, period. Not in hospitals, not in acute care hospitals, all nurses everywhere in Massachusetts. A 6% increase in wages, along with the 2 to 7% increase in the amount of nurses that are going to be needed in these hospitals. Source, please go to the source. Read both studies. Read both of these situations and see how they were calculated. That number, that $900 million, is not true. It's just not true. Unless, if you honestly believe that all wages for all nurses across the board, including the ones that are not in hospitals, are going to raise by 6% the day this bill passes moving forward, by all means you can believe that. But that's the assumptions they made, and that assumption just seems out of this world. Would I love a 6% increase? Of course I would. I would love a 6% increase, but that's bullshit. We all know that that's just straight bullshit. So you have the information. The link below, studies from both parts, the Health Commission policy and from the Boston College study, from a nursing economist. And you guys can make those decisions for yourself moving forward. So now let's talk about those representatives here in Massachusetts that are now finally coming out and saying where they stand on the ballot question, on the staffing ratio ballot question. So we're going to start with one of my faves. One of my presidential hopefuls for 2020. Heart and soul, ladies and gentlemen. Senator Elizabeth Warren. Okay, I just want to read you this quote coming out from the gate just to let you know where she stands. She said it wonderfully. I love it. Hear her out. Nurses work hard to take care of all of us when it matters the most. And we should do the same for them by establishing standards to ensure they have the help they need to do their job safely. She continues on by firmly saying, I stand with our nurses and support a yes vote on question 1 in November. So right off the bat, you know that Senator Elizabeth Warren is standing on the yes side. So we've got one on the yes side. There's many more at the end. I'll tell you who else. But we have Senator Elizabeth Warren on our side. And I just want to tell you a little bit about Senator Elizabeth Warren. There's many more. I'm going to talk a little bit more about Elizabeth Warren because her background and who she is really will help you understand why at least believing her if you don't have the time to go in and dig and do all your research and all that good stuff and look at both sides and look at the actual bill and all of that nitty gritty, because this is why we vote for representatives, so they can do that nitty gritty while we live our day to day. It's not our day to day job to look at the nitty gritty of each of these bills and what it's going to cost us Americans. We vote for these representatives so they can do that job. And the reason I'm saying you should believe Elizabeth Warren is let's look at her record. Let's look at what she has done for Americans, for those in Massachusetts. Who is she? And that maybe will help us judge what her motives are when looking at a bill like the nurse staffing ratio. So in the past, most recently in 2017, she co-sponsored a bill, Nurse Staffing Standards for Hospital Patient Safety and Quality Act, which was very, very similar to question 1. I'm not going to go into the details, but I'll put the link below in the description box. Go check it out. So it'll have all of the information on the bill she sponsored. This was a nationwide. This was federal. It was going to be a federal bill across all 50 states. It's very similar to question 1. Go check it out. She co-sponsored it. She co-sponsored that bill. So we already know she's for nurses. This is not her first outing here with the nurses. So telling you a little bit about Elizabeth Warren's history. So Elizabeth Warren was formerly a professor of law and taught at the University of Texas, the University of Pennsylvania, and most recently Harvard Law School. And she's also a prominent scholar specializing in bankruptcy law. Warren was among the most cited law professors in the field of commercial law before she began her political career. And I think this is super, super important, right? So Elizabeth Warren, it doesn't stop there. And it's not just for nurses, and she's not just a nursing hoorah hero. She is a Massachusetts, a Bostonian hero. She is here to represent us, and she wants the best for the people, not for the big business, for the people. And yes, I'm talking to you nurses as well. She is an active consumer protection advocate whose efforts led to the conception and the establishment of the U.S. Consumer Financial Protection Bureau. And if you don't know what that is, ladies and gentlemen, you've been missing out on a whole lot. The Consumer Financial Protection Bureau has saved Americans, Massachusetts folks, like the actual people. When I say the people, I don't mean the business behind the people. I don't mean the budget of Massachusetts. I mean actual human beings, people, billions of dollars. Let me tell you the exact numbers here. From its creation until 2017, the Consumer Financial Protection Bureau has curtailed abusive debt collection practices, reformed mortgage lending, publicized and investigated hundreds of thousands of complaints for our aggravated customers of financial institutions, and extracted nearly $12 billion for 29 million consumers in refunds and cancel debts. So if you're going to ask me the question, so Q, great, this is all amazing things that Elizabeth Warren has done or is doing currently, but why should I be on the same side as Elizabeth Warren? And I think it's clear as day. Number one, if you're a nurse, you know that she has a track record of standing with nurses everywhere. And then number two, the conception. She is the mother of the Consumer Financial Protection Bureau, thereby also being a big part of why 29 million Americans have received money that they lost unfairly to these big, insane businesses like the Massachusetts Health Hospital Association. When Elizabeth Warren says the right side of history is being on a yes, I agree. She's well known everywhere. She's a big name. Most people know who Elizabeth Warren is. So, and when she comes out and says, I stand yes, there's a reason behind it. She's not just trying to cozy up next to us nurses. She has a history of staying with the people. And I agree. And I'm thankful that she's voting yes and is telling those in Massachusetts to also vote yes. Thank you, Elizabeth Warren. Thank you, thank you, thank you. So before I end, I just want to tell you a few more representatives that are not as well known as Elizabeth Warren, and it's mainly why I chose her to talk about. But other people that are also backing the bill include Boston Mayor Marty Walsh. Good for you, sir. I already told you about Senator Elizabeth Warren, Ed Markey, Representative Catherine Clark, Jim McGovern, and Joe Kennedy III, and Michael Capano. And those are all of the people that are also backing, that are also voting yes when it comes to question one. I think it's very important that you guys know who is standing where on this issue and why. Maybe they're just doing it so they can get on nursing good side, but I don't think that's the case for Elizabeth Warren. Like I just told you, she has a verified background of looking out for nurses and just the people of America. Right? Not the businesses, not these multi-billion corporations, not the people that are giving money to her campaigns, for the people, for the actual people of America, for the actual nurses here in Massachusetts. Thank you, Elizabeth Warren. So I'm not going to be super biased and just tell you who voted on the yes side and tell you all about how much I love Elizabeth Warren and Joe Kennedy. No. I'm going to try to be as fair as I possibly can. And the biggest well-known representative name that I found that was voting on the no side was Governor Charlie Baker. If you didn't know who he is, he has been our governor. He's the 72nd governor here in Massachusetts. So when Governor Baker was asked why is he voting no, he cited that same study by the Health Commission policy that I just did a story on earlier today. So please, I'm begging with you, I'm pleading with you. If you're watching this just as a clip or somewhere else that's not YouTube and it's not part of the Nursing News segment, I'm going to put in the link below the actual story that I did when discussing that actual study, the study that Governor Baker has cited when saying this is the reason I'm voting no. He thinks it's going to cost Massachusetts way too much. I went in depth of how that study is just disproportionate. It's bullshit. The study is bullshit. The numbers they use to make the assumptions on how this bill will affect Massachusetts and the taxpayers is bullshit. So please, please, please go look at that segment, go look at that story, and then we'll move forward. So just right there off the bat, when asked, how are you standing on the issue, on staffing ratios ballot question, he said no, because of a bullshit study. And I'm calling it a bullshit study. That's just my personal thing. So go check out the story, look at the study, and a link to the segment is going to be down below. So that's why he's voting no, because he thinks it's going to cost too much, which I disagree with, if I didn't make myself clear. So let's look at his history, just like we did for Elizabeth Warren. Let's look at Governor Baker's history. Why is he voting the way he's voting? All right, outside of that immediate study reason, what in his past can tell us a little bit about where his intentions lie when making this specific vote? So let's talk about what he did prior to becoming the governor. Right? That's what was your job? What were you doing prior? We know that Elizabeth Warren was a law professor. We know that she is the reason we have the Consumer Financial Protection Bureau. What has Governor Baker done for Massachusetts, done for nurses? What has he done for the people? So, prior to being the governor of Massachusetts, Governor Baker spent 10 years as the CEO of Harvard Pilgrim Healthcare. Do I need to say any more? Do I need to say anything else? I mean, this is Harvard Pilgrim. I mean, we're going to talk about who is against this bill, who is going to lose money, and at least in the immediate effect of this bill. These insurers are the number one outside of the actual hospital association, which I talked about, who is funding all of these voting no ads. Outside of the hospital association, these insurers are going to lose money. And why are they going to lose money? Because patients are going to be safer. Because having more nurses leads to safer patient outcomes. That is just a fact. The studies are, it's okay. I'm not going there. I know. I'm sorry. Sticking on the issue. This was his job. He was the CEO of Harvard Pilgrim. So I don't need to say any more, but I will. Many people say that the Governor Baker has saved Harvard Pilgrim. When he worked there, he saved it. They were going under. He came in. He did what he had to do. And I'll tell you what he had to do. He did what he had to do, and it turned Harvard Pilgrim around. And today, Harvard Pilgrim is one of the biggest, largest health insurers in Massachusetts, along with the United States of America. So let me tell you how our great Governor Baker saved Harvard Pilgrim. Right? Let me tell you how he did that. He raised premiums during his 10 years there. He raised premiums 150% and tripled his own salary to $1.7 million during his decade at Harvard Pilgrim. This, my friends, is the person who's voting no when it comes to safe staffing ratios. Out of all the representatives I know, yes, there's many more, but this is the most well-known that I found that I wanted to pitch to let you know where he stands. Governor Baker, the former CEO of Harvard Pilgrim, who during his time there raised premiums not for hospitals, not for the insurers, not trying to look out for you, the nurses, not trying to look out for you, the patients, the people of Massachusetts, or the people of the United States. No, he was looking out for his own pocket and for Harvard Pilgrim's financial budget at the end of the year wallet. That's all he cared about that time. So let me ask you guys the simple question is so that is Governor Baker, and that's who he was prior to becoming governor, and he told you the reason he's voting no. He's saying he's voting no because it costs too much. But did he care about how much it cost when he raised those premiums 150%? Did he care how much insurance was going to cost the average American, the average folk from Massachusetts when he was adding to his own salary? No, he did not give a shit. He didn't care. All he cared about is how much money can I walk out of this place with? How much money can I make my business, which was Harvard Pilgrim? And now he's voting no, citing that it's going to cost too much money. He didn't care about how much it cost for you 10 years ago. He did not give two shits. But now he cares. Now he cares all the world. When his salary is on the line, he does not care at all. When his salary is on the line, he will up your premiums 150 goddamn %. But now, Oh, he's worried about how much it's going to cost the taxpayer. He doesn't give a shit, ladies and gentlemen. He just doesn't give a shit. There's no way in hell you can tell me someone who raised premiums and that was his claim to fame. His claim to fame was saving Harvard Pilgrim, and how he saved Harvard Pilgrim was increasing your premiums 150%. And today he's going to stand here, look you in the eyes, and tell you he cares about how much this is going to cost the taxpayer. He doesn't give a shit. He just doesn't. All he cares about is how much money he can get in his pockets and what he needs to say to get the votes he needs to become governor again. Ladies and gentlemen, on this alone, I would vote against Governor Baker, but I haven't done my research, so I'm not going to go out and say vote for whoever is against Governor Baker, because I don't even know who is. I don't know who is, so I'm not going to be that guy. But I am saying on this alone, just makes me look at him at an entirely different light. Entirely, all right? So that's the last story I'm going to do on the staffing ratios for this week's nursing news. But I want to leave you guys with this question, right? We vote for these representatives to do the hard work. So I know when you go out and you're talking to people, they say, do your research, look at the stuff, look it up, look it up, look it up, look it up. And yes, it's super important to be an informed voter, but when it comes to situations like this, it's really difficult on our day-to-day as busy people that it's not our job to look at this stuff up. Yes, it affects us, and yes, we want to be informed, but there's a limit. We have shit to do. This is not our livelihood. We vote for these representatives to do that nitty gritty, right? So, given those two options, given that we've voted for both Governor Charlie Baker here in Massachusetts and Senator Elizabeth Warren, we, the Massachusetts residents, have voted for those two people in office. Yes, they're not both senators, they're not both governors, they're not representatives, but it is their job to do their research, to come up with an answer, to help us citizens, to represent us, to give us the best hope for a better future for Massachusetts, right? So given those two options, Elizabeth Warren and Charlie Baker, we know that Senator Elizabeth Warren, who was a former law professor, whose claim to fame was the conception of the Consumer Financial Protection Bureau, which, by the way, saved up over $12 billion for 29 million Americans across the U.S. and has co-sponsored a nurse staffing bill for federally that would mandate some safe patient limits in all hospitals across all 50 states. That's option number one. Senator Elizabeth Warren, who is publicly saying, I am voting yes and you should too. And then your second option, the best well-known representative here in Massachusetts that I could find that is voting no, Governor Charlie Baker, who's been our governor since 2015, and prior to that, he was the CEO of Harvard Pilgrim, one of the largest health insurers in the U.S., and it doesn't just stop there. His claim to fame, remember, Senator Elizabeth Warren saved 29 million Americans over $12 billion. Governor Charlie Baker's claim to fame was that he saved Harvard Pilgrim from going under during his 10 years there, but the way he did it was increase your premiums, our premiums, the residents of Massachusetts and the people in America. He increased their premiums over 10 years 150%. And added to his own salary, which ended up being $1.7 million. Those are your options. You have Senator Elizabeth Warren, who saved millions of Americans' money by fighting these humongous corporations. That's option one. Or Governor Charlie Baker, whose claim to fame is saving Harvard Pilgrim from going under by increasing your premiums 150% over 10 years. I think that there's no question about it. Even if you know nothing about the ballot question. If you know zero about the ballot question, but you just look at who's voting yes and who's voting no when it comes to our representatives. And like I said, I'm just giving you those two options. But when you look at the yes side, you have Joe Kennedy, you have Mayor Marty Walsh, so on and so forth. But just on those two alone, the biggest names on both sides, the yes and the no side, Senator Elizabeth Warren and Governor Charlie Baker, when you just look at those two, the answer is clear as day. When you look at the two representatives and you look at history alone on who has looked out for the American citizen, on history alone, on who has looked out for Bostonians, on who has looked out for nurses, The answer is clear as day. It's Senator Elizabeth Warren and Governor Charlie Baker. I don't know. I looked. I really wanted to find something that you did that was positive for nurses, something that you did that was positive for patients here in the state. Nothing. All I could find was the great accomplishments you did when you were at Harvard Pilgrim. So that's it. I know I get crazy when it comes to this bill ballot question because it's so hard. The people on the yes side cannot compete with the ads, the money that these health insurers, that these healthcare, that the hospital association, that all of these big businesses are giving the no side to put up these ads for. We can't compete with them, and that's why I get so heated and I get to go on these crazy rants, and I apologize for that. But all the links to the actual studies, all the links to the backgrounds of both senators, all of this stuff is going to be in the description box below so you can look at it yourself without hearing me scream, rant, and get all emotional about it, all right? So all of that stuff is going to be in the description box below. Please click it. Go look for it. Look at it yourself. Let me know. If Charlie Baker is the greatest senator, is the greatest governor that's ever been for nurses, let me know why, and then I will apologize. But until then, Senator Elizabeth Warren has shown that she stands for and with nurses, stands for and with Massachusetts, the residents of Massachusetts. Charlie Baker, brother, all we know about you and what you love talking about is how you saved Harvard Pilgrim. And like I said, there's many more representatives on both sides, the yes and the no, that have their own reasoning behind each. I just wanted to talk about the biggest, most well-known here in Massachusetts, and that just so happened to be Elizabeth Warren and Governor Charlie Baker. Let me know who else is voting where. Give me the reasons. Tell me why. Tell me why I'm wrong for siding with Elizabeth Warren. Tell me why I'm wrong for being upset that Governor Baker increased premiums at 150% and now is telling you in your face that he's worried about the taxpayers' money. Bullshit. I'm calling bullshit. Ladies and gentlemen, vote yes on ballot question 1. Safe staffing equals safer patient outcomes. Please and thank you. So let me try to calm down here, ladies and gentlemen. Let's move on from this ballot question, all right? Because that gets me too emotional, right? Nurses, you know why I get emotional. You know, especially if you live in Massachusetts. So you guys all know the saying, too much of a good thing, too much of any good thing ends up being bad. You know that saying. Well, this new study found out that there's one exception to that rule. And that exception is working out. I love it. I love this. I love this. There was a new study that was published Friday in the JAMA Network that found that any level of cardiovascular fitness, including the kind you'd see from elite athletes, is linked to staying alive longer. And the reason I wanted to talk about this is because in recent past, we've heard, at least I have, and I don't know if you, but if you have, let me know in the comment section below. I've seen all of these studies and these articles that come out that say, oh, these Michael Phelps athletes, all these, all of the athletes, the marathon runners, all of these people that do these crazy cardio heavy sports and they spend the majority of their life doing that, is doing damage to the heart, is doing worse things for their heart or just as bad things for their heart as a couch potato that eats a Big Mac every single day for every single meal. I never believed it. I was like, there's no freaking way. But there's finally a study, and a long-term study, that has come to the conclusion that yes, it is absolute bullshit. So let me tell you what the study, how the study went about. So they looked at more than 120,000 patients, average age of 53, who had taken an exercise treadmill test at the clinic sometimes between 1994 and 2014. The test results gave the researchers an objective measure of someone's overall fitness. Then, using Social Security, medical record numbers, and all that good stuff, they tracked the patients until they died, or until some of them have died, and now they're coming up with the results of up until today. So by the end of 2017, about 13,500 people had died. Across the board, the authors found the more fit a person was, the less likely they were to be sent to an early grave. And while the life-saving effects of exercise did start to taper off, with elite athletes only being slightly more death-proof than merely highly active people, the researchers found there was no observed upper limit of benefit. So a huge caveat when it comes to this study. So you saw how the method and how they went about doing the study. And the first thing that popped into my mind was the quality of life that these people that are living longer are living, right? So we know constant repetitive movement, especially if you're an athlete, and we know this for every athlete in the history of athletes, the more you do something, the more you're using those joints, and then you form arthritis, you lose your joints, you need replacements, so on and so forth. You know how that ends, right? I wanted to know, was their quality of life good, bad, or were they just living longer? But that wasn't the question that they were after. The link is down below. You can look at it and you can see the actual study, the method, the methodology, the whole nine. But to answer the simple question, does cardiovascular exercise, even at those elite athlete levels of exercise, is it doing good, bad, or is it not a factor when it comes to longevity of life? And the answer is absolutely clear. Yes, every single author all across the board said the data shows there's correlation, causation. The more you exercise, the longer you will live. Full stop, period. The actual conclusion, and I'm going to quote the conclusion, they said cardiorespiratory fitness is a modifiable indicator of long-term mortality, and healthcare professionals should encourage patients to achieve and maintain high levels of fitness. So, just being super clear about this study. It says specifically cardiorespiratory fitness. So it's talking basically aerobic exercises. So running, swimming, long distances, not just sprinting there and back. No, talking about long distance running, sprinting, swimming, all of that stuff. So you know me, if you follow me on Instagram, which by the way you should most definitely do, I love going to the gym. I love CrossFit. When I think of the best workout in the world, I think CrossFit. But it's not talking about CrossFit. It's talking about cardiorespiratory. It's talking about aerobic, not heavy weightlifting, not things that are going to be heavy on the joints, none of that crazy shit, not short bursts, not even sprints. It's talking about long distance running, endurance workouts, aerobic workouts. The answer is clear. The better you do that, so go on your walks. When you go through nursing school, they always say walking is the best exercise you can advise your patients, from young to old, doesn't matter the age, pregnant, non-pregnant, whatever. Whatever your situation is, if you're able to walk, go walking and do it a lot and do it often. Right? Because aerobic exercises are clear. And it is a modifiable indicator when it comes to determining the longevity of one's life. It's modifiable, meaning you can live longer. You can live longer by just going for a walk, by going for a swim, by going for a run, going for a jog, getting on that bike, cycling your way through victory. Do it. Do it all. All of it. All of it. And then some. There's a new app that has come out this prior week. It just got okayed. It's in the ether, the App Store ether. It's going to allow patients to text their healthcare providers, talking about nurses, advanced practitioners, nurse practitioners, PAs, and doctors. That is going to allow patients to text these healthcare providers asking them for information. And I don't know how I feel about this new app. I think it's exciting that this is a thing that people can sign up for. But let me know what you guys think. But let me tell you exactly the details, because it's not as crazy as you think. You're not going to get a text some random time today. No, it's you have to sign up for it. Let me tell you what it's all about, all right? So the new startup wants to help you figure out if your medical issue requires a visit to the doctor's office, to the ER, or can be handled over a telemedicine service, while also providing you with some basic information about the problem and its severity. I think this is super helpful, because this can clear out EDs, ERs across the US, the world, period. This could be some revolutionary shit, right? So when someone texts you, and as nurses, you know everyone in their family, once they find out that you're a nurse, it definitely happens to other healthcare providers. Once someone finds out that you work in healthcare, they send you pictures of their ass rash. They send you pictures of their weird toe, their disgusting poop. Is something wrong with me? And that's just family and friends. But this is something that you guys can get paid for, nurses and healthcare providers. You can get paid for to get patients to actually text you and saying, look at my leg, look Look at my poop. Look at my rash. Let me describe to you how I'm feeling. Should I go to the ED? Should I call my PCP? Should I go to an urgent care center? I love this. I love this. So Michael Shealy, the founder, he is a serial entrepreneur. The way this whole thing came about is he has a daughter who had a congenital heart defect, had open heart surgery. He didn't know what to do. They went through all of the teaching, and you know how it is in hospitals. You have a doctor coming, you have the surgeon coming, you have the nurse coming, you have the PA coming, you have everyone and their goddamn mother coming. They ask you, they tell you all these questions, they throw you all these booklets, they make you watch all these videos, and yes, they try all to do it as best as they possibly can. They have follow-up appointments, but you still have 1,000,001 questions in your head. And he said it, and if you read the article, you'll go through it. He says that he Googled everything, Medscaped everything, and he just got scared and then worried and then thought his daughter was going to die any second. So he decided, let me text one of my wife's friends who was a nurse practitioner, and that's basically how it started. After having that conversation with his wife's friend, the nurse practitioner, he was like, oh my goodness, people need to do this. Because I can't imagine the stress of having a baby that just had open heart surgery should be. You would be worried. You would think that every sneeze meant something, that every cough meant something else. If the baby wasn't eating because they were tired, you would get scared out of your goddamn mind. So I feel for the brother, and it makes sense why he reached out to this nurse practitioner. But he's saying that, oh my goodness, the world needs this. Because if it wasn't for the nurse practitioner that I was texting, I would have been taking my baby, my daughter, to the ED every single day. And I think it's phenomenal. So let's get back to the app. How does it work? What is the situation? Where can I find it? Let me let you know. So the app has been tested with over 1,200 patients and received interest from over 190 nurses who have since joined its platform. It's free to end users if the patient's provider is signed up on the Nurse One-to-One. And that's the name of the app. I forgot to tell you that the name of the app is Nurse One-to-One. I think that's super important to know. I'm sorry, I'm not really good at this. I was excited about the content, the juice. I wanted to just cut right in. But for those out there, the name of the app is called Nurse One-to-One. I'll make sure to use it as the actual wording here so you guys can see it. So Nurse One-to-One is the app. It's been tested. It's been approved. A whole lot of nurses have signed up for it. And it is free. If you are a patient, if you are one of the users, the end user, and you want to use this app, if your provider has signed up for the app, it's free. If not, it's going to be $12.50 per chat that you have with the provider. But think about it. Yes, $12.50 might be a lot of money, but if you just go to your ED and they say go home, nothing's wrong, drink some orange juice, you're spending hundreds of dollars for a doctor to tell you that. I love this, and I have to put it in there because it's super important. It's healthcare information. The service works both via the web and through the iOS app, so it's only for Apple as of right now. And most importantly, all you healthcare providers know it out there, it is HIPAA compliant, and data is encrypted end to end. All of it stays within the app, stays within the web browser. Nothing comes out. It's not going to go on my personal text messages. I don't get to show pictures to my nursing friends of what's going on with you. That's not how it is. It is HIPAA. HIPAA compliant. I love this app. I think it's amazing. All of this new healthcare tech that's coming through is just efficiency and prevention is the name of the game, and I love when apps go and attack those two things. Sticking with our mobile phones here, ladies and gentlemen, we're moving on to the Instagram suggested story of the week. Please, ladies and gentlemen, follow me on Instagram once a week. I ask y'all, the people out there, what stories do you want me to cover? Once you guys let me know, I do that story on that week's nursing news. And this week's suggested Instagram story comes from Lauren Perry. Lauren, girl, thank you for the suggestion. I love it. I love it. I love it. This is the third week I do this, and these suggested stories always end up being some super exciting stuff. So if you guys don't know, Law Perry is her Instagram handle. It'll be somewhere here on the screen, please, and it's going to be a link down in the description box below. Go follow her. Super exciting. Thank you for the suggestion. So you might ask you, what did Lauren ask you? What was the suggestion? Tell us. We want to know. And I love this because it's moving healthcare forward. She asked me to discuss CP. CP, community paramedicine. Let me tell you let me read you the actual definition. I looked this up. This is beautiful. If this is something we move forward doing, sky is the goddamn, let me just tell you what it is, all right? The official definition of what community paramedicine is. It is a new and evolving model of community-based healthcare in which paramedics function outside their customary emergency response and transport roles in ways that facilitate more appropriate use of emergency care resources and or enhance access to primary care for medically undeserved populations. So that is a whole lot of words, but let me break this shit down for you, because there's three major, there's a million different models. There's various different states, including Massachusetts, that are right now attempting types of community paramedicine, which is fantastic. But I'm just going to give you the general broad three main ways community paramedicine can help current healthcare. The best demonstrated benefit of CP programs has been in getting persons who have accessed the EMS system but do not have a medically emergent conditions to more appropriate destinations than a hospital ED. I think that this is probably the most immediate way you can see results if you are implementing some CP programs, and I think it's super, super useful. Because in the current state right now, you call the EMS, if the EMS comes and picks you up, you are going to the hospital. They're not taking you anywhere else. You can't go to an urgent care. You can't get a ride to your primary care. You can't get a ride to your chiropractor, your PA, whatever the situation is. No, right now you call an EMT. If you get picked up by an EMT, by the EMS, you are going to a hospital. And this would allow for the EMS system to say, you know what, your situation is not as emergent, emergent enough to need to go into an ED. And this is just so amazing, because how many people, I don't know because I'm not an ER nurse, but I do know the statistics of how many people come into the ED, walk in, they sit in and take up a room, because you can't have more than one patient in an ED room, right? So they come in, they sit into a room, they stay there for hours and hours just for the doctor to come in and say, you're okay, put a Band-Aid on it, drink some orange juice, go home. You don't need to be here, right? This is insanity. I think this is game changing, and this is only the first out of the three. It's amazing. Lauren, thank you. Thank you, Lauren. Moving on, number two, CP programs can provide short-term, within 72 hours of discharge, follow-up home visits for patients who have just been discharged from a hospital or ED until other providers are able to provide the home visits or other follow-up care. Such follow-up care may help prevent ED or hospital readmissions. And this one, as a nurse doing some discharge teaching, you know this and I know this, especially when patients get discharged on Friday or during the weekend. If they need some visiting nursing, if they need some home health care, and the home health care or the visiting nursing, they can't do their evaluations over the weekend and they have to come by on Monday, and that's when they'll do evaluations to start doing the daily home health care. We know how important those first 2 days being home are. We know how important it is for those patients to actually take the discharge education moving forward and not be at home without any help, without any assistance. We know how that can result in so many readmissions, and worse, having the patient's condition worsen unnecessarily. So I think I just talked about how number one is a game changer, and it's probably the most immediate change that you will see. But this is the kind of change that will help patients and healthcare in the country long term. This is preventative. This is preventing them from coming back to the hospital. This is making sure that they continue with the education that they were given when they left the hospital. This is amazing, and it just makes sense, right? Because especially when these EMTs, and I hear stories from EMTs and EMS people, when they have slow days, and I don't want to say that they do nothing on their job, but when they have slow days, they're just in their car waiting for a call. Instead of just sitting down waiting for a call, go to a patient's house that has been discharged and let them know, this is what you need to be doing. We know that the visiting nurses are going to come by, but this is what you can do. This is what you should be doing. These are the meds you should be taking. This is perfect. This is perfect. And I'm not even done. Last one, I promise. Last one. Number three, CP programs aimed at providing primary care for medically undeserved populations may also provide opportunities for EMS personnel in low call volume settings, examples rural areas, to further develop patient assessment skills as well as more frequently utilize their basic skills. This helps them maintain their skills and expand their clinical experience. Phenomenal, beautiful, excellent. Prevention is the winner chicken dinner of healthcare. And point number three, reason number three, we want to start with these CP programs is because it would prevent a whole lot of crazy, unnecessary health conditions and issues that would lead to patients coming into the ED, going into hospitals, having chronic diseases. But not just for everyone, which is important, and hopefully if they have enough, everyone can have an EMS visit and just remind you to take your medications, be healthy, and all that good stuff, but for those undeserved. Those patients that don't have the money, that don't have the time to go to their doctor's visits because they have 3 jobs and they're trying to support their families. The patients that can't afford health insurance, that can't afford to go into hospitals. This is another way that the CP programs can help. Lauren, this is a fantastic suggestion story. I love it. I just get so excited when things like this. I mean, the CP programs, the community paramedicine model, healthcare model, is a game changer. We need to begin these programs ASAP. All right. Love this story. Thank you, Lauren. Again, don't forget, follow her. Links in the description below, and her handle is somewhere right here. Lauren, you're the best. Community paramedicine programs. Let's get to it now. Moving on to the nurse of the week. You know we can't do nursing news without doing the nurse of the week. And this week's nurse of the week is Katie Vigos. I am sorry if I'm saying that name wrong, but from here on out, I will call you Nurse Katie. So Nurse Katie gets the nurse of the week because she is the reason, because she started a petition that got Instagram to okay birthing videos to be shown on news feeds and not be taken down for censorship, due to censorship. Let me tell you how it formed. Nurse Katie, I think it's phenomenal. Good for you. I love it. Thank you. Nurse of the week, all of you. Let me tell you how this all rolled out. So currently, Nurse Katie is 33 years old. She works in critical care flow pool in California, and that's what she's doing. But when did this start? When she was 22 years old. I think that's right. Yes. When she was 22 years old, she had her first baby. When she had her second baby, she wanted to do it naturally, right? She wanted to do it at home. She did not like the experience she had when she was 22. When she attempted to have her baby naturally, she wanted to take note of all of this stuff that she was going to, document it and share it with the world, because when she was going through this whole process, she was like, I can't find any information on this stuff. What am I supposed to do at home? Yes, you have all these cameras and these model pictures of how things work in hospitals, but there was no examples of how to have your own baby at home, the old natural, no epidural, just you in a bathtub in your bathroom, how to do that right. And that's what she wanted. And instead of asking for it or looking for it, she went through a process, reading as much as she possibly could, and wanted to document it for the next mother that wants to do the same, which is commendable. And on that alone, you should be Nurse of the Week. But Nurse Katie has done so much more. So moving forward, she wanted to do this, and she was quoted by saying, I wanted to be able to show women and tell them what's possible, especially because I had to figure it all out myself the first time. She documented her journey going through a second pregnancy through the Empowered Birth Project. And if you don't know what that is, there'll be a link in the description box below. And it's what it says it is. It empowers mothers who are giving birth, and it tells them how to do, what to do, when to do it, and the ways to do it. So that's how she was documenting her journey. But every time she would put something up on Instagram, it would get taken down because it would be like, it's too much. You're showing too much. You need to censor this. It's a social media app. All of this BS, right? So after all of these pictures were getting put down, she was like, you know what? I'll play by the rules. And she used these cool artsy types. I don't want to say artsy, but she took all these pictures without showing any nipples or any body parts or any of the actual birthing process, like pictures from under the legs where you would just see the thigh, or pictures from the belly where you wouldn't see, but you'd see the baby. I'll show you some examples up here somewhere. So pictures where it wouldn't show any of the vagina, any of the nipples, any of the actual birthing process, because that would be considered too much. And she was playing by the rules. But then she got this fantastic, fabulous video. I don't know which video it is, but this is what she told nurse.org. She got a fabulous video and some pictures of a friend giving birth, and she said, the world must see this. This is fantastic. This is gorgeous. This is life, right? This is the conception of life. This is how life works, right? The world needs to see this. And she put her foot down, and then she was quoted by saying, in that moment, I looked at it and thought, I'm sick of this double standards. I'm sick of the censorship. This needs to be on the internet. And I love it. I love it. You go, girl. Nurse Katie, you're the goddamn shit. You're right. It does need to be on the internet. And thanks to you, today it is. So, and she talks about this double standard because if you scroll down Instagram any day of the goddamn week, you will see Instagram models booty shaking, twerking videos, popping bottles on titties and these parties of ladies doing nearly everything but sex on Instagram. But if you're having a birthing video of life happening, of the beauty of life actually happening, it gets down due to some censorship. She was like, bullshit, I'm done with this shit. So she began the petition on change.org, and a little over 1 month, she got 23,000 signatures. And then Nurse Katie says that Instagram reached out to her to inform her that her petition had tipped the scale of a conversation they'd been having already, and that they would be changing their guidelines soon. Were they actually having the conversation? Did they just use that as an excuse to move it forward? It doesn't matter. What matters is if they change the rules. Today, you can go on Instagram and you can see a video of life happening. You've allowed mothers to share the pain, the struggle, the agony, the beauty of birth with the world. Thank you, Katie. I mean, just thank you. I just want to end on a quote that she said, a beautiful quote. She says, birthing people don't have the support they need. I'd like to be able to use my influence on behalf of policy change that makes giving birth a better experience for everyone. I always want to keep a foot at the bedside, but I do see myself stepping more fully into my advocacy. Let me tell you something, Nurse Katie. You want to step your foot into advocacy? Advocacy is your goddamn middle name. You're kicking ass at advocacy. I understand it might not seem big to other people out there, but understand, Instagram, Facebook, all of these social medias has millions and millions of people's eyeballs on it, billions of people's eyeballs on it every single day. If this is somewhere where you can post some educational, some helpful, some health-related birthing videos, I think you have changed millions of lives and you don't even know it. Thank you, Nurse Katie. I love it. And then final story of the day, sticking with babies. If you're a nurse and you like babies, newborn babies, I'm talking about fresh cheeks of pink babies. I'm talking about them new babies. If you like those babies, you can make up to $800 a day. So let me tell you how you can do this. So rich families across the U.S. have been hiring nurses, baby nurses, to take care of their newborns for 22 hours a day. You sleep when the baby sleeps, but you're there to take care of the baby for 22 hours a day, and you can make as much as $800. Baby nurses work 22-hour days and don't take a day off until 3 or 4 weeks after the baby is born. They make between $600 and $750 a day on average, where you can make as high as $800. It depends on where you live and the competition and how much the family is willing to pay you. And then last but not least, parents are keeping baby nurses for much longer than in the past, up to 9 months instead of what usually these agencies have baby nurses go out for, which is used to be 3 months, and then with the changing of times, up to 9 months. That last note as to why people need baby nurses for longer, I have a whole lot on that and I want to get there. But before I get there, I want to ask a simple question. Where the fuck do I sign up? Please and thank you. $800 a day to take care of these cute little adorable babies. I know newborns aren't easy. 22 hours with a newborn is insanity. Not having a day off and needing to work 22 hours is crazy. But understand this. Let me just give you a quick scenario. Without a baby nurse in the household, what happens? What happens? The mother does the job. The mother takes care of the baby. And I say the mother because it's 99.9% of the time the mother, and that's obviously not a real statistic, but it's the vast majority of the time the mother is taking care of the baby, especially when it's a newborn. The mother stays with the baby. The mom breastfeeds the baby, the whole nine. That's what the mom does, right? And yes, the dad is helpful and all of that stuff. It's true. I get it. I'm not trying to make this sexist comment here. I'm just saying, without baby nurses, the mom does the job. So this is a very much doable job, especially if you're coming in to help a mom with their baby. They're obviously going to be around and helpful. And if they're not, no worries. You're just doing what a mom would do. And you're doing it with the cutest, most adorable baby, right? I love this. Where can I sign up? Please and thank you. I would love, 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 love to be a baby nurse. I think this is incredible. Highlights, if this is one of your first videos of you seeing me, I say it all the time. One of my major goals is to work into L&D just for a little bit sometime in my nursing career. And the reason being is because my favorite, absolute favorite clinical experience was when I worked when one of my clinicals was in L&D, and I got to stay in the NICU and just cuddle and play with one of these babies. And yes, it was just an 8-hour day, and I was in there for like maybe 4-5 hours, but it was one of the most, it was just one of the most peaceful, I just loved being there. I loved those babies. This story just when I saw it, I said, I have to become a baby nurse if I'm never going to be an L&D. So that last bullet point where the baby nurse agencies are saying that it's much longer. It used to be 3 months, and now families are wanting baby nurses to stay up to 9 months. I think that has a lot more to do with the society and the situation, healthcare, and just the workplace is here in America. So number one, there's no maternity leave. There's no federal law saying that your company has to have maternity leave, paternity leave, any of that good stuff. If you work for a company that has those things, good for you, congratulations. But the vast majority of people don't. That's not a thing. But yeah, so 3 months to 9 months, people need to go back to work sooner. People need to get on the ball, get some money. It's going to cost $1 million to raise this baby. Forget about their college tuition. All of these things come into play when you're becoming a parent. And you can't make money and stay home at the same time. Well, at least not the majority of us can. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.